Why does that man have a light bulb stuck?
Dewey, get away from him.
Questionable medical equipment that's definitely going to leave a mark, and how not to treat your patients. In honor of the reboot coming out today, we are breaking down and reacting to all of the chaotic medical moments from the classic sitcom Malcolm in the Middle. Let's dive right in.
Malcolm, why are you walking like that?
My side still hurts.
Okay, everybody get in the car. We're going to the hospital.
Mom, why does that man have a light bulb stuck?
Dewey, get away from him.
It does happen. Light bulbs getting stuck up the rear end.
Either this kid has a light bulb up his butt or his colon has a great idea.
But usually they go in. If the kid can actually see the light bulb, then you probably don't need to be at the hospital. Probably can be removed.
Dad, you okay?
I'm fine, son. Just not a big fan of hospitals.
He's profusely sweating.
You're sweating.
The medical term for profusely sweating is diaphoresis. People don't like this, so anxiety goes up, heart rate goes up, you start having a fight or flight response. Sweating is one of those.
Okay, we've run some tests. His white count is 12.2.
White blood cell count of 12 is a little bit higher than normal. It's not like high. It's just 1.5 or so above normal, which is around 10.5.
And with these acute abdominal pains, I'm pretty sure we're looking at appendicitis.
He was actually holding his left side of his abdomen earlier on the clip. Your appendix is in the right side, unless you have situs inversus, where everything is flipped in your body, which is rare, but people do have that.
And this is our inflamed appendix.
Unless he is the surgeon that then went down to the emergency department to consult, he wouldn't be rounding on him on the floors of the hospital. The ER doctors treat the patients in the ER, and that is it. You can see the people behind him are wearing short coats. A short white coat typically means you are a medical student.
The patient arrived today complaining of abdominal pain in the right lower quadrant.
Ow!
Complaining of pain in the right lower quadrant, but he pushed him on the left, and quite hard. We don't do that. Gentle and then a little bit deeper, and smooth motions, not hard motions like this.
We're going to have to start him in an IV. Catherine?
Oh, God. Not me again. Please.
It'll be fine this time, Catherine. Accidents happen.
Could maybe someone else...
How long will hold him still?
You need to have a game face. You should already have spoken to your attending and know what your skill set is and not, and when to practice and when not to practice. So not good. You're already getting the patient riled up. Depending on the age of the patient, we might need assistance in helping the patient not move, just because it's dangerous if you're using a needle and somebody is flailing around.
I'm feeling a lot better now, and my temperature's been down for 6 hours, and I'm thinking that maybe my first blood test wasn't accurate.
His fever has come down. With appendicitis, you should be having an infection type symptoms, so you will potentially have fevers and you will be treated with antibiotics.
Now, this is what we call a hysterical patient.
I'm not hysterical. I just think it'd be smart to run another blood test before you commit to cutting me open.
He's asking for a repeat blood test. You're typically not driven by somebody's blood if you are trying to figure out if you need to take their appendix out or not. You can have a normal white blood cell count and still have appendicitis. Typically, you're going to do nowadays imaging to prove it.
Take this.
What's this for?
Sedatives.
No, I'm not going to. You can't...
Oh, man. Sometimes before surgery, you will be given a medication, typically a benzodiazepine, before going to the operating room. But typically, the sedative will be given IV. You just don't want anything in the stomach if you're having a surgery where they've delayed it, so you have an empty stomach, just because of increased risk of aspiration, regurgitation. They just don't want that.
I have great news. You see, I just had another blood test, and it shows that I really don't need surgery, because if the blood count goes down to normal, that means it isn't appendicitis. It was probably just a transient infection or maybe even a cold sore.
A cold sore is the herpes virus.
Herpes, herpes, banana, herpes.
Not to be confused with a canker sore, which is just caused by a non-specific virus, but that shouldn't cause a systemic fever unless it's your first outbreak.
I need to talk to Dr. Harrison.
Hi there, sport. We'll have that appendix out in no time.
How many of you watching have ever had your appendix removed? Let me know in the comments. The surgery is pretty easy. There are some immune cells in there, so it's not a benign organ, but we can live without it.
Do not operate. H&H 16 and 47, platelets 310. These are blood test results. White count 8.4, is that right?
White count was 8.4 on repeat. H&H, which is just hemoglobin, and hematocrit 16 and 47, just normal, maybe a little dehydration actually.
I will sue your ass for malpractice.
Maybe we should run another blood test.
I don't think that threat and then getting a blood count would change anything unless the doctors back in the day were following the white blood cell count to decide if they needed to operate on an individual. Oh, old school cold plunging. What? People use it all the time prior to cold plunging getting popular. Icing up different areas to help with recovery. Even when I was a soccer player, I would go to rehab due to injuries and have to go into like the whirlpool to help with decreasing inflammation in my joint that got injured.
I've been numbing my legs in ice for an hour now. What?
Oh, probably not the smartest thing. Typically, good rule of thumb is 20 minutes on, 20 minutes off with ice. But when you're fully emerged like this, even a little bit less time, 5 to 10 minutes, you're potentially decreasing circulation.
I can't feel a thing down there. See? Nothing. The first 3 times I did that, it hurt like hell.
He just stabbed himself in the leg. The water is probably quite dirty.
Dirty.
And you don't know if you actually stabbed and broke the skin. Very dangerous. Don't do that. You might have actually hit all the way into muscle tissue or into a vessel or your bone, and you're just going to increase the risk of infection.
Ta-da!
Oh. Common, people do things at home repairs, storage, and things fall on their head, knock them out, cause lacerations.
What's that white stuff? Is that bone? What?
Is that bone? Actually, it could. The bone actually in that area is gonna look like a whitish cream color.
Bone white is very white.
But you can also be seeing the fascia overlying the frontal muscle.
Get ice and some paper towels. Sit down, we have to put pressure on.
Good direct pressure. Wash your hands. You have to just think about bloodborne pathogens, unlikely in this young kid.
Give me the ice, come on.
Grab the ice. We got this.
So not bad, but raw chicken, these containers leak a little bit. You actually might get some of that material into a wound, increasing the risk of a bacterial infection. But the ice to decrease some swelling and to help numb the area so it helps with the discomfort.
Fine, give me some antiseptic.
He wants to get an antiseptic to put on the wound or something to clean the wound. Not a bad idea as well.
For God's sake, you kids again. And a head injury. You boys like to keep it interesting, don't you?
Typically, if you are home and you don't have an adult around and there was injury, please call 911. The first responders will get there. And you wouldn't just show up to the hospital like this. Typically nowadays, you're gonna go to like the window or the front registration to register to go into the emergency department.
Look, Doc, about the bill.
Oh, don't worry. We'll send it to your parents.
This is good positioning, left frontal laceration. Probably would have gotten a CT scan of the head. Clean out the wound, you anesthetize it. You're gonna clean the skin around the area and do sutures.
We were kind of thinking we pay for it now.
Okie dokie, but it's probably going to be about $400.
What?
400?
Don't you have some kind of frequent customer discount?
Nice. Nope, we don't have frequent customer discounts at the emergency department. But there are cash pay options for individuals, but the doctor is typically not going to know how much that costs.
Or maybe we could work it off. We can empty bedpans or wash cadavers.
You can see his forehead is like a little bit of an orange color. That orange color is going to be betadine most of the time. Once you get these stitches in the forehead there, typically you're going to be in for about 5 days.
All right. Get in there.
Thanks. A peptic ulcer? How did you manage to get a peptic ulcer?
Oh my gosh. Peptic ulcer is basically an ulcer within the stomach lining. Can just cause bleeding, pain. Worst case scenario, it can actually cause a perforation.
The doctor said you have the stomach lining of a 60-year-old air traffic controller. You are a teenager, for God's sake. What do you have to be stressed about?
Stress can actually cause a peptic ulcer. Bleeding peptic ulcer, they're gonna keep you in the hospital. Do the endoscopy, watch your blood counts and just make sure they stabilize.
And the jack to put in this IV couldn't find a vein with 2 hands and a flashlight.
I get it. The situation at the hospital is not fun. It sucks sometimes. Yes, some people have difficulty finding veins, or the veins for yourself are hiding. The stress can cause your vessels to collapse. You might be dehydrated. You might be hypovolemic. You might actually not have a lot of red blood cells.
My call button doesn't work. These stupid sheets are itchy. There's only one channel on the TV.
I feel like Malcolm's mom, and even Malcolm himself, could use a bit of a chill pill. It's actually one of the reasons I created Chillax by my company Life Happens. The doctor-formulated occasional stress support supplement. Check out Chillax at lifehappens.com or on Amazon. Oh.
Call me a taxi and then call Dr. Kirk.
I just love the head cushion that is wrapped around. It looks like a life preserver. Typically, what this is supposed to do is actually prevent you from moving your head. It really looks like a life jacket.
He's in the book. Then call AAA.
Dad, calm down.
I will not come down.
It's strapped to a long, hard board, which we don't do anymore. Being on that board can actually increase the risk of more injuries and pressure sores.
Hello. Hello.
Oh my gosh.
Sir, you're not going anywhere in the shape you're in. Give him 10 milligrams of diazepam.
He's freaking out a little bit, and hence that's why the doctor's giving him diazepam, aka Valium. 10 milligrams of diazepam is gonna make you go to sleep. Depending on his injury, he can leave against medical advice. He doesn't need to be there.
I'm leaving.
Okay, then. That was always allowed.
If he's not having any pain, he'll sign all the forms that say, I don't want your care. The doctor will go through why he needs to be there at the hospital.
Let me out of here. I'm
I like how the nurse just has it in her pocket ready to go. Doesn't happen that way. It's a controlled substance. It needs to be taken out of typically a Pyxis machine or a machine that is under lock and key and monitored who's taking stuff in and out of it.
I have to get home to her.
Give him 10 more. I want him immobilized.
Oof. He's giving 20 milligrams of diazepam in a quick dose. Thing you have to think about is airway management. Typically, it's just going to be a sedative, but it could increase the risk of somebody not controlling their own airway. This is not a dose that we would typically use in our current emergency setting. Oh. I've never seen that happen before. Oh my gosh. I feel like he's going to go down pretty quick after that 10 milligrams of diazepam. Stop it. Oh, how's he gonna make this happen? Yeah. So dangerous, they wouldn't allow this to happen. This is a good depiction of situations where people can leave the hospital against medical advice, but if they actually gave the diazepam, they wouldn't let that patient leave out of the hospital that easy because it's a danger. They can trip, they can fall, they smack their head open, they can walk into traffic. You're liable because you gave that medication. You are now responsible for them. Malcom in the middle. These clips were really funny from a medical standpoint for me to check out. If you guys enjoyed this and you want to see more, please let me know. And definitely check out this playlist right here. Please watch everything, help the channel grow. Please subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.